Okay. Good morning, Mrs. Smith. My name is Nancy. I'm going to be your nurse for today, and we're going to be suctioning your trach. So if you have any questions, please ask me, Ms. Smith. I checked her ID band. She also has no known allergies. Ms. Smith, how are you doing today? Okay, I am listening to her to see if I hear any gurgling, and then that's another indication that suction needs to be done. So I'm going to go ahead and show you how to set up for trach suction. As of right now, we're going to turn it on intermediate between, I believe, 120 and 160 or 120 to 180, okay, which would be here. So you would turn it to the right until it's got to about there. I would also wash my hands before I start. I have my suction here, and then if we have our yank hour attached, which it was, we would take it apart, take the yank hour off, and begin to prepare. So as of right now, our suctioning is going, and we have our, that's all taken care of. So to start this, we're going to open our field, because it's going to be a sterile field. It's going to be away from the body, right? Okay, and then you have your, sorry, your sterile glove. So, I go like that. I grab it by the edges, my 2-inch margin. And that's not supposed to happen. It's not supposed to go back on the other one. That means, okay, so you got to touch the outside. Okay, that's not supposed to happen. Sorry. Okay, I broke sterile field, and I know it. Okay. All right, so that's done. I'm going to open these. The other thing is once you have a sterile field, you're not supposed to turn your back on it. Why don't these want to stay open?
There's 2 beds next door.
Yeah, okay.
There's 2 beds next door,
So we have our sterile basin here, and we're going to take our normal saline and we're going to put water in here. So we have our suction, okay, because I'm going to be suctioning with this has to stay clean. Okay, so I take that out, that's garbage, I got my water in there.
There's a couple people that, is anyone going to be back there fully soon?
So I'm going to take this, okay, and then I'm going to take this. This doesn't feel right because I'm going to go like this. This is our suctioning, so our suctioning is on, and then I'm going to stick this in my normal saline, okay, to make sure that it works. So I'm going to, not pump it, but put your finger up and down. I forgot what they called it. So you're going to go like this to make sure that water's coming out, and then the other thing that I would have done was that I would make sure my patient is sitting up because she has a trach, because I don't want her to aspirate. So if I was going to do it, I would, you go into the trach, okay, with your finger off of it, and then when you come down, when you come back up, you suction, you go like this to make sure that it's not continuous, otherwise they will become, you'll take too much oxygen out. So you have to pump it. I can't remember what they call it. Okay, so then I'll do that, and then I'll clean it like this, and then it'll go into the canister, and then I'll keep suctioning her, okay, 3 times at the max, okay, and I don't go all the way down. I do believe that you only go, I don't remember how far we go down, but I know it's not, we only go a little bit down, because otherwise we'd irritate the lungs. So that would be it, okay? That's it.